Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Ant2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show. As you know, we're here every Tuesday, 6 to 7 p.m., and also on Fridays, 5:30 to 6 p.m. with the How to Stay Healthy show. This broadcast is brought to you by All County Healthcare, living a longer and healthier life. All County Healthcare is a Medicare certified home health agency. If you have any questions about Medicare or home health, you can call 1-888-717-7170 and ask for Maddie, and she can answer all your questions. They also have a great website, allcountyhealthcare.com, and I'm actually on their Facebook page right now, and I always do this. We're on Facebook Live, All County Healthcare Incorporated's Facebook Live page. I actually do this every week now. Share it right to my page as well. So that is a really neat option for social media. Tonight on the program, we have a pulmonologist, and boy, I sound like I could use one. I definitely got something going. I caught something in the last 2 days. When I asked the doc if it sounds like an upper respiratory infection, but I know he can't diagnose over the air. But we're going to talk with him. It's Dr. Brian Gotkin about COPD, IPV treatments as well, where his practice is. And I've actually been to his practice. He offers pulmonary rehab right in the office with his colleague, Dr. Stephen Gittler, over there in Hollywood. I believe he also, as most pulmonologists do, specializes in sleep medicine, and I know he specializes in critical care. So that's going to be the first half of our program. Second half of our program at 6:30 on the dot, or just after, we're going to have Dr. Vanitha Vasudevan. She's a general surgeon and oncological surgeon over in Fort Lauderdale as well, just down the road from here in Boca Raton. Focuses on treatment on everything from the pancreas and liver to breast cancer surgery, thyroid, I believe gallbladder as well. So she'll be joining us at 6:30 p.m. You can always call in if you have any questions for either of the doctors, pulmonology or general surgery related tonight. And without further ado, I want to introduce Dr. Brian Gotkin. Dr. Gotkin, how are you doing tonight?
I'm great. Thank you very much, David. I'm sorry I can't be in studio with you, but I appreciate the opportunity to be on the air with you tonight.
Oh, most definitely. We're just glad to have you because, as you know, it's COPD Awareness Month, and, that is something that's been in the news a lot lately. I got to be honest with you, I didn't even know what it was until about a couple years ago. Can you tell us a little bit about it from, a medical standpoint, kind of give us a definition of what COPD is exactly and why it's so prevalent today?
Sure. So COPD is an acronym. It stands for chronic obstructive pulmonary disease. And under chronic obstructive pulmonary disease, we have two main diseases, chronic bronchitis and emphysema, both of which make up COPD. So oftentimes I'll have somebody come to the office and they'll tell me, I was diagnosed with COPD. And I'll be like, well, do you have emphysema? And they're like, no, I don't have emphysema, I have COPD. But they're really one and the same. And the difference between chronic bronchitis and emphysema is chronic bronchitis is more of that productive cough that people will have, and emphysema is more of problems with shortness of breath and dyspnea with exertion, or dyspnea meaning shortness of breath. So COPD is a preventable and treatable disease that's characterized by persistent respiratory symptoms and airflow limitation that is due to airway and or alveolar abnormalities, usually caused by exposure to noxious particles such as tobacco. Yeah.
And we talked about this a few years ago. Actually, we did a testimonial in your office, and it was actually a gentleman who actually got COPD from a combination. He told us of he was like sandblasting as a painter because of those
any kind of like noxious particle that you inhale, whether it's tobacco or it's work related or pollution, anything that basically gets into your lungs can cause damage to your lungs and can lead to destructive changes in your lungs, causing COPD. So the lungs are in constant communication with the environment. We're always breathing in air, and we're breathing in everything that goes along with the air. So if you're in a bad work environment or even potentially secondhand smoke, you can get problems with shortness of breath, COPD, bronchitis, that kind of stuff.
And this is something that also comes on, obviously you said secondhand smoke, particles in the environment, but it's mostly, you see it mostly from smoking, years of smoking?
So in the majority of the patients that I see, it's related to tobacco. But there are people who have asthma when they're younger who don't get treated. So asthma, which differentiates from COPD, is reversible, whereas COPD is not reversible. But in patients who have asthma who don't get treated at a young age, they can sort of get fixed disease that will look like COPD or emphysema.
Oh wow, I didn't know that. That's interesting. I did not know that if you have asthma at a younger age and it's not treated properly,
if you don't treat it, because it's inflammation, and if you don't treat the inflammation, it can look like emphysema at a later age. And sometimes you can't really differentiate what's COPD and what's asthma, especially in people with the history of smoking. And oftentimes we treat them similarly.
As a pulmonologist, what age range of patients do you see? Do you see mostly a little bit older population, baby boomers, that kind of population, or is it all ages?
So COPD is typically in people who are in their 50s, 60s. However, you can definitely see it at a younger age, and you can see it at an older age. But in my population, I'll see it in Medicare age patients in the 60 and older range.
Now,
just because they're younger, it doesn't mean that you shouldn't think about it.
I see, definitely. It's good to know what it is because, like you said, it's not reversible. But if I believe so, we've talked. Yeah, if you get it treated quick enough, you can kind of halt it.
Yeah. So I mean, the main thing to halt the disease progression is to stop smoking. So for those who are active smokers who are already developing symptoms, if you continue to smoke, it's just going to get worse. As everybody gets older, their lung function declines. But in people who are active smokers, the decline in lung function is at a much more steep rate than people who either never smoked or who used to smoke and have quit smoking. So yes, a smoking cessation is key to prevention.
I got to ask you because we always see that commercial, and I don't even know what pharmaceutical it is, but it's about the elephant sitting on the man or woman's chest, and they go to the doctor and they said, "Doctor, it feels like I have an elephant sitting on my chest." Is that something that you've heard before from patients who've later been diagnosed with COPD?
Yeah, so definitely. So things that can bring a patient to the office would be somebody who has shortness of breath, somebody who has cough, somebody who has chest tightness, somebody who has wheezing. So yeah, they can feel like they have a vice around their chest, that they're being squeezed, or that they have an elephant on their chest, and that can be a sign of COPD.
Wow, that doesn't sound fun, because I got to tell you right now, I don't know if you hear my voice, but I came down with something the last few days, and I can't breathe that well, and I think I got like upper respiratory infection, but it is tough not, having your full lung capacity. I couldn't imagine living like that.
And so there is an anxiety component that you can understand in people who can't breathe. So if you can't breathe, you can become anxious and you can start to hyperventilate. And if you hyperventilate, then you can sort of what's called breath stacking, and which would make things worse. So what I tell people who don't have COPD, if you wanted to get the sensation of somebody who has COPD, take a breath in, hold it, and then try to breathe from that perspective. Because those are people who are hyperinflated, who can't completely exhale, get rid of their air. That's the sensation that they have when they have COPD.
Oh, man. And so if that's something that you or your family members are dealing with, definitely go see your pulmonologist and get that looked at, because that is not a fun quality of life for sure. Let me ask you also, now we talked a little bit about the symptoms. How do you, as a pulmonologist, how do you diagnose this this nasty disease?
So first of all, people come to me with symptoms. So most people are symptomatic by the time that they come to see me. So they have, like I said earlier, shortness of breath, cough, chest tightness. So they come to the office with these symptoms. You inquire about a smoking history, because most people with COPD will have a smoking history. And then what you can do is you can do pulmonary function test. And pulmonary function test is a breath test where they would blow into a machine and we measure their ability to exhale air. And in people who have COPD, their ability to exhale air is impaired. So what we look at is the forced expiratory volume, which is their ability to blow out air in 1 second, and compared to their complete ability to blow out air. And in people who are obstructed, those numbers will be decreased. So it's history plus testing, such as pulmonary function test. Sometimes on x-rays we can suggest that people have emphysema because their lungs are big, they're retaining air, they can't exhale it, so we call them hyperinflated. So symptoms and testing will lead to the diagnosis of COPD.
Now, how do you treat this disease?
So treatment is directed at symptoms. So unfortunately, we don't have any cures for COPD yet. But COPD is a disease that causes bronchoconstriction, or narrowing of the bronchial tubes. So most of the therapies that we use for COPD are bronchodilators, or medications that would open up the airways. So medications like long-acting beta agonist, long-acting muscarinic agents. So these are medications that we use that go to the cell type that's within the bronchial tubes and cause a relaxation or an opening of the bronchial tubes. So there's multiple medications out there for COPD. So we use medications for treating COPD. Sometimes we can use oxygen for treating COPD. We employ pulmonary rehab or exercise training for patients with COPD. And then in the really severe patients, there are some surgical treatments for COPD, such as lung volume reduction surgery, where the people who have hyperinflated lungs or big lungs, we take away part of the lungs to restore the previous anatomy function to the lungs, and even lung transplant.
Wow, as a pulmonologist, do you do those procedures, or is that referred to a surgeon?
So, yeah, surgeons would be the ones who would do the lung volume reduction surgery and do the transplants. And really, there's only a few centers in the country that are doing lung volume reduction surgery, because pulmonary rehab is key to those patients getting the lung volume reduction surgery. And it's best done in big centers. But lung transplant is being done locally. Down at the University of Miami, they're doing it, in Tampa, and Gainesville, and Jacksonville. So there's a bunch of different local transplant centers.
Okay, wow, I didn't know University of Miami. That's where you went to medical school, right?
That's right, yep.
Oh, okay, so you have a lot of contacts there, I imagine, still to this day.
Yeah, I do. I know people on staff there, and I refer patients down there.
That's great. Now, let me ask you, in terms of, you talked a little bit about medication. I've come across this IPV treatment, intrapulmonary percussive ventilation. Is that an effective form, maybe if the medication or something's not an option?
So IPV is a percussive device. So what we have in the adult population is something called VEST, which is like a chest physical therapy. So in people who have a lot of sputum production, we can put a vest on them that will vibrate. Rather than having somebody clapping on your back, clapping on your chest to get rid of the mucus, there is a device called the vest that we can put on people, and it will help mobilize the secretions. There are other devices that we use to train the muscles, basically resistive devices. So you blow into these devices, and you can set the gauge to determine how much pressure they're pushing against to basically train the muscles to breathe again. There's also devices called a cappella flutter valves that we use also to help mobilize secretions. So it's not first-line therapy, but we think of using those devices in people who have a lot of sputum production, difficulty clearing their airways.
Dr. Gotkin, we're going to take a quick break, but on the other side, I want to ask you a few questions more about pulmonary rehab, sleep medicine, and your training as well, which is pretty impressive there, the fellowship training. But right before I go to break, I just want to ask you, how can people get in touch with you? You're at Sunrise Medical Group, right?
Right. So I'm down in Hollywood, off of Sheridan Street, and I can give you my phone number.
I got your number right here. I'm ready with it. You're at Sunrise Medical Group, 954-981-3700. That sound correct?
Yeah, that's right.
That's what's on your website. So I was ready, actually. So on the other side, we'll talk a little bit about those options for pulmonary rehab on the You and Your Doctor show.
Okay.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hey, Dr. Gotkin, we're back. A little break there. You're still with us, right? Just want to make sure.
I'm still here.
Awesome. We got a good connection. I like that. Right before the break, we talked a little bit about IPV treatment, and where your practice is located, etc. And I'll give out that info again. I want to talk about the pulmonary rehab at your office because I had a chance to visit your office once, and I was just amazed at this whole room of pulmonary rehab you have right in the office. I've never seen that before. I've seen at rehab facilities like attached to hospitals and whatnot, but take us on a little virtual tour of what's going on in your office.
Right. So I think we're unique in the fact that we're a private practice that employs pulmonary rehab as part of our practice because we think it's very important to treating the patient. Typically, you won't see this unless it's hospital-based, but in our office, we have it attached to the office right inside. So we use pulmonary rehab in patients who have moderate COPD. And while pulmonary rehab doesn't prolong survival or cure COPD, it has been shown to improve patients' symptoms, their quality of life, and just how they feel in everyday activities. So oftentimes I'll have patients who can't breathe who tell me, there's no way I can do pulmonary rehab. There's no way I can get on a bike. There's no way I can get on a treadmill. But what we do is we tailor toward every patient. And the goal of the therapy is to improve their quality of life, to improve their exercise tolerance, to improve their endurance, and make them feel better. Also, we talked earlier about anxiety contributing to shortness of breath. So we have a respiratory therapist, Sharon Tucker, who's in charge of the rehab. She talks to the patients and she tells them how to relax, how to breathe when they can't breathe, how to do what's called pursed lip breathing. Because the worst thing that can happen to these patients with COPD is that they would hyperventilate and that they breath stack. So she teaches them basically how to breathe all over again.
Wow, and I've seen it firsthand. And if you want to see the testimonial that I'm talking about, you can go to sunrisepractices.com. Just put in Dr. Gotkin's name there, Gotkin, and then and then you'll be able to see the testimonial I keep on talking about of Mr. David Kunde, who actually had COPD or has it and was able to improve his quality of life by seeing Dr. Gotkin. Now, Sharon's amazing. Like I said, I've seen it firsthand. Now, do you also, I see it on your title here, you also specialize in sleep medicine as well?
That's correct. So I did an extra year of training in sleep disorders. So as a pulmonologist, I see a wide range of diseases. So I see my pulmonary diseases like COPD, pulmonary fibrosis, pulmonary hypertension, lung cancer, bronchiectasis. But then I also see sleep patients. So I see patients who have obstructive sleep apnea, people who are referred because their spouse says snoring is terrible, we can't sleep in the same room anymore, and the patient's tired all the time. So I see my sleep apnea patients. And you also see like your narcolepsy patients, patients who just have a hard time staying awake, who do not have sleep apnea, who will nap during the day, who can even have what's called cataplexy, so they can have like a strong emotion and the muscles of the body basically go to sleep while their mind is actually awake. So we see a wide range of sleep disorders. We have a sleep lab attached to our office. We do overnight sleep testing. We do home sleep testing. So, yeah, it's part of my practice, and we see a lot of patients with sleep disorders.
That's right. I did see that. I forgot about that. You have a pulmonary rehab and a sleep center right in your doctor's office.
4-bed sleep unit.
Wow.
In the office.
Unbelievable. And that fellowship that you referenced there, I want to just mention it. This is very prestigious. And correct me if I'm wrong, you did a fellowship in sleep disorders at Mount Sinai Medical Center in Miami, correct?
Right.
And fellowship in pulmonary critical care at the University of Miami Jackson Memorial Hospital, also in Miami, right there.
Correct.
Oh, I'm glad I got that right. That's fair. That is great. And quadruple board certified, I'm looking here on the website, critical care medicine, pulmonary disease, internal medicine, and sleep medicine.
Correct.
So if you have any pulmonology or sleep disorders, definitely go and see Dr. Gotkin. I'm going to give out his info again, but I've been joined by All County Healthcare's respiratory therapist and sleep tech, Ed Salazar. Ed, I know you have a couple questions for the doctor. I want to introduce you to Dr. Brian Gotkin.
Dr. Gotkin, I enjoyed your comments very much. I would love an opportunity to meet you sometime.
Sure, anytime. Come down to Hollywood.
My particular passion in respiratory therapy is, trying to reduce readmissions for COPD, to hospitals. And, I'm very proud of the fact that, we have been able to employ IPV. The Percussion Air Corporation came out with a platform that has a self-contained compressor. So the therapy can be given, anywhere, pulmonary rehab in the patient's own home. And we've had pretty good success at improving airway clearance when that is the primary issue that causes the exacerbations.
Yeah, so I think anything that helps patients whether it's a vest type therapy, the IPVV that you're talking about, anything to help them get rid of their secretions, help open up their airways, help with their respiratory muscles. You can, even BiPAP at night for people who have elevated carbon dioxide levels. So any of those modalities is great to help people stay out of the hospital.
And these are modalities that break up that mucus, that congestion that's going on. Am I correct in saying that?
Well, I think what it is it's basically chest physical therapy without a respiratory therapist there. So, so it helps mobilize the secretions. It's a vibration device that you wear, and that will help with the clearance of the secretions, so you don't have retained secretions causing problems with pneumonia and atelectasis and respiratory muscle fatigue. It's not a medication per se. It isn't a medication. It's not a medication. It's basically someone's clapping on your chest, vibrating. I mean, the respiratory therapist can talk about his own experience with the device itself. But that's the goal of therapy, is to clear the secretions and relieve the sensation of dyspnea and drowning.
Well, as the old cliche goes, there's more than one way to skin a cat. But
Right.
what I'm encouraged about you is that at least you and your practice are making these things available to some COPD patients. It sounds like it's a very progressive practice.
Yeah, I think it's great to be able to offer patients these opportunities to feel better and to have emotional and psychological support to help them get through this disease, because any kind of chronic illness can bring on depression and anxiety. And I think when you're in a room with other people with similar diseases and they can share their stories together, I think it's great for the patient.
Okay, well, thank you. I hope sometime soon, I get a chance to come by your facility. I was there years ago with Dr. Bolton.
Oh, yeah. Dr. Bolton used to work there.
So I know exactly where you're at, and thank you very much for the invitation, sir.
Okay, no problem.
And Dr. Gotkin, you hit it right on the head. Thank you, Ed. We haven't had a call-in, fly-in guest in a while on the show, so that's great that we're really, this show is really expanding. But Dr. Gotkin, you hit the nail right on the head there. Like I was telling everyone, my experience kind of observing your pulmonary rehab, the people in there, yes, they had ailments, but they're very happy with the care they received. And then the camaraderie in there, they're all telling stories, talking about TV shows they enjoy, what works for them in terms of their rehab. It kind of became a network of friends. And then you popped your head in and you were going around the room, and Sharon Tucker's kind of the host there, who kind of keeps everyone in check and up to date on what they're doing. And then it's like kind of a station change. They're going to different exercise machines and whatnot. But I really noticed the camaraderie, and you said it right there. That's bringing the quality of life to patients. Is that something that really helps with the treatment? Is feeling good about it?
I definitely do. I think, oftentimes in any kind of chronic illness, if mentally you've sort of given up, I feel like the body gives up too. So I think that the atmosphere is a good atmosphere for patients. They feel better about themselves, and I think that it enables them to go on longer, at least to provide some quality of life.
And Sunrise Medical Group, where Dr. Gotkin is, a great group of pulmonologists, neurologists, some of the most dedicated physicians I've ever been around. And as you know on this show, you've listened to me for the last year, I've been around some very dedicated physicians, probably some of the top physicians in the world right here in South Florida. But what a great group there, Sunrise Medical Group. I want to give out your info again. Dr. Brian Gotkin, Pulmonology and Sleep Medicine. Give him a call at 954-981-3700. He's over in Hollywood, just a short drive from here. I believe it's about less than 40 minutes from Boca. It's worth the drive to see this pulmonary rehab. 7369 Sheridan Street, Suite 302, Hollywood. Still in Suite 302, right? Same place that I was at?
Correct.
Okay, I just want to make sure I know we've We've had some location changes at Sunrise Medical Group, but yeah, 7369 Sheridan Street, Suite 302, Hollywood. You can go on sunrisepractices.com, type that in your search bar on your computer, smartphone, or tablet, and then just type in Gotkin's, Dr. Gotkin's name there, Gotkin. You can see his physician information. We talked a little bit about medical school, University of Miami, internship, McGaw Medical Center, Northwestern University, Chicago. I love Chicago. What a great school, Northwestern. That must have been neat, going to an internship and residency in Chicago, huh?
It was a lot of fun. It was definitely a change weather-wise, but it's a great city, and the medical center is right off of Michigan Avenue, downtown, so it's a great location.
I'm very familiar with Chicago. My mom's from Chicago, so when I saw that, it really made me smile. Now, are you originally from South Florida?
I grew up in South Florida. I wasn't born here. My father's from the New York area. I was born in New York. My mother's from Chicago area. So I still have some family in Chicago, and that's what drew me to Chicago for my residency.
Oh, really neat. And it looks like you had a great medical school internship residency. We talked about the fellowship. I only have one more question for you. What are your hobbies and passions outside of medicine? What don't we know about you?
I enjoy sporting events. I enjoy participating in sports. I enjoy going to sporting events. I went to the University of Michigan undergrad, so I enjoy college football. I went to Miami for medical school, so Michigan and Miami are my college schools that I enjoy watching. And I'm a local guy, so I like the Dolphins, I like the Marlins, the Panthers. So those are things that I like to do.
No wonder we get along so well. I mean, I like all those teams, and everyone knows FAU as well, as we're having our banner season. So right here in Boca Raton.
I don't want to turn away any Notre Dame fans or Ohio State fans. But,
Good to know. Good to know.
Right.
Well, Dr. Gotkin, thank you so much for coming on the program. You're always welcome. Join us again. This was so timely for COPD Awareness Month. We couldn't have had you at a better time. Definitely come on the show again. I really appreciate your time and the info.
I appreciate it, too. Thanks for the invitation, and I had a great time.
Thank you, and we'll be back on the You and Your Doctor show.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back. Hello, South Florida and beyond. We got an action-packed program today, as you know. Just had Dr. Brian Gotkin on talking about COPD and sleep medicine. And then we're going to have Dr. Vasudevan, general surgeon on oncological surgery as well on the program in just a minute. As you know, we're sponsored by All County Healthcare, living a longer and healthier life. If you have any questions about a Medicare certified home health agency like All County Healthcare is, or about home health in general, you can call Maddie at 1-888-717-7170. Go to allcountyhealthcare.com. Or if you're not driving around one night, Tuesday 6 to 7, but you're at home on the computer, you can always go to their Facebook page, as I'm doing right now, All County Healthcare Incorporated. Type that into the Facebook search bar. You'll be able to view the program anytime. So that's kind of neat. Oh, we got some likes there. That's good to see. Oh, we got some comments. Wow, that's great to see too. Social media is amazing, so I always like sharing it while I'm here. It's just changed so much. I've been in media since 1999, and wow, what an industry that's really changed. But that's enough of me going on about social media. I want to welcome Dr. Vanitha Vasudevan to the program. Dr. Vasudevan, how are you doing tonight?
I'm doing great. Thank you. Thanks, David.
Thanks for making it here in studio. I know you had a little bit of a drive. You're over in the Fort Lauderdale area, but
Correct.
everywhere's a drive in South Florida nowadays.
Yes, that is true.
So, tell us a little bit about your practice. Now, I've had general surgeons on before. I don't know if I've had a general surgeon combined with oncological surgery. How did that come about, and what are the treatments that you can help people with?
Right. So I specialize in general surgery and in surgical oncology. That's more like the area where I'm developing my practice. As part of general surgery, we trained to treat all kinds of cancers, and so this is just taking it a step forward. I did a specialization in minimally invasive surgery, and so the transition to treating oncological surgery using minimally invasive technique is where I'm developing my practice.
Oh, I see the connection there now, because I'm a little bit old school in my thought. I'm thinking general surgery. My mom had her gallbladder out. I know that she saw a general surgeon for it, but
Right.
that's the traditional general surgery that you do
Correct.
as well. But
Correct.
then you take it a step further, doing these minimally invasive. Tell us a little bit about minimally invasive and why that's important.
So nowadays, with all surgeries, we try to minimize the amount of trauma the body is handling. Surgery is a big stress, so we try to minimize that. So the incisions have become smaller. It's like 0.5 to 1 centimeter, sometimes a little bigger than that. So we try to do most of our abdominal surgeries using these minimally invasive techniques. It basically helps decreases the pain in the postoperative period. It helps heal faster, and people get back to work faster. So those are the predominant goals we work towards, and then that lengthens the amount of time they need in the hospital.
Yeah, I was just going to say, and out of the hospital faster, which the hospital is actually happy about.
Right.
And you're happier about as a doctor because there's less chance for infection.
Correct.
And the patient's happier because they're back to their normal life.
Right.
Or somewhat near it.
Yeah, and that's what we're striving for, is that basically that improves the quality of the healthcare that they're being provided. So that's a big step in this decade.
I just have to
decades,
thank all surgeons and you in particular for the amount of work that you do. And I know you were telling me how many hours. I'm not going to mention it on the air, and I know you have a family, but just the way that medicine is progressing, and this group of surgeons and doctors in general, the technology, you guys just get it like I've never seen. And we were just talking about technology in journalism just a minute ago, and then now in surgery as well. And one of those technologies is a robot called, and correct me if I'm wrong, it's the Da Vinci robot.
Right.
And you're trained on that?
Yes.
Oh, wow.
So robotic surgery is a new field. Relatively new, I won't say very new. It's been on for the last decade or so. Slowly making more and more progress. Da Vinci is pretty much the only robot available right now in the US market, and basically works in the same principles as a minimally invasive surgery. So the amount of incisions are smaller. The robot actually helps us work with more dexterity and a three-dimensional visualization, and all that improves the quality of surgery that you provide.
And it's actually I actually attended a robotic surgery at Da Vinci. Yeah, I did early on. It was actually at Delray Medical Center, and I actually stood behind the surgeon as they're in kind of a console.
Right.
So you're in that console. You're kind of away from the table, but then laparoscopically, you're doing
Correct.
surgery with the instruments, the robot.
Right. So we insert the instruments through the robotic arms, and then we sit at a console and are actually manipulating the arms. So a lot of people ask me, a lot of patients are like, "Oh, what if the robot starts working on its own?" It's not designed to work on its own. We move the arms for it to work. So it's just to get that dexterity, like a wrist movement. That's very useful, especially if you're working in a tight space in the abdomen.
Like you do, and it's like you said it before. It's precise. That's what it's about.
Right.
And you're moving the robot where maybe your hands couldn't move or turn.
Correct.
That's what
correct.
it is.
And
It's not. Yeah.
Yeah, that gives a lot of dexterity of movement.
Unbelievable where it's medicine. And like listeners, I have seen this surgery, and it's amazing. I would love to see another one as well. I've actually attended 4 surgeries. I really think it's amazing. I'm just in awe when I'm in there, and really neat. Now, we talked a little bit about gallbladder before. I just wanted to bring it up because it seems like it's so common in women.
Right.
I just don't understand. My mom's had gallbladder surgery. My wife, her mom, her sister. So that's the other side of the family. My mom, I don't know if my grandmother did or not. Why is it so prevalent in women?
It is more common in women. It used to be the to do with your fat metabolism and things like that. It does occur in men too. It's not that does not occur in men, but predominantly the number of people that come with symptomatic stones in the gallbladder and things like that. That the stones in the gallbladder is kind of more common in women than in men. But having said that, a lot of other factors like obesity and diet and all these also contribute to development of gallstones.
Oh, okay. There are lifestyle factors as well. I didn't know that. Learned something new. Now, when is it? I think you mentioned already, but when is gastrointestinal or gallbladder surgery needed? When it becomes like a pain issue, though?
Correct.
Those stones you said.
Right. So gallbladder surgery is predominantly performed for stone disease. There are a few other indications like the stones causing pancreatitis or other complications. Sometimes you get polyps, which we worry that may turn into cancer, and then we offer the gallbladder surgery, which are things that are very much less. I would say more than 80% of indications for gallbladder is stone disease, indication to take it out. The other gastrointestinal surgeries is basically our gastrointestinal system involves stomach, our small intestine, liver, pancreas, all of these which contribute. Most of the time there are tumors or just obstructions and things in the intestines or in the stomach that require to be removed, and then they need these surgeries, gastrointestinal surgeries.
Let's go back to the stones. What makes up those stones? Like, what is the actual material that the body creates?
Most commonly is cholesterol stones.
Oh,
So
really?
it's actually just what we call supersaturation. The body makes bile normally. The liver secretes that, and it stores in the gallbladder and is waiting. When you have a fatty meal, the gallbladder just pumps that bile out to digest the food, and when it's sitting there and super saturated and the body is making a lot more cholesterol than it's supposed to, that condenses and forms stones. So cholesterol stones are actually the more common stones. The other type is when you get what you get called pigment stones, which are made of all the pigments in the body from breakdown of your blood cells and things like that, which also the liver metabolizes, but it's stored in the gallbladder.
I thought cholesterol was only something we had to worry about the heart. It
No.
gets in the stomach as well.
Well, yes,
Yeah.
it is because the liver is what has to mobilize everything. So if if for some reason your body's metabolism is not the best, then the cholesterol stones are likely to form.
Another reason to be healthy,
Right.
to eat healthy.
Yes.
Like you mentioned it, fats. We talk a lot about doctors on this show. We have cardiologists, fats, They're obviously not good for the system. Now, let's go to another part of the body. It seems like you treat the whole abdomen and thoracic area there. So, you also offer breast surgery for breast cancer patients.
Correct.
October was just Breast Cancer Awareness Month, so
Right.
very timely as well. But when does someone see you to actually have the cancer removed?
Right. So, as everybody needs to get a mammogram routinely, and that is pretty much the most common way we're picking up cancers is through routine mammograms. So, whenever there is an abnormality in a mammogram, they're referred to see a surgeon. As a general surgeon and as an oncology surgeon, I get a lot of patients with breast abnormalities on mammogram, and depending on the type of abnormalities, we get biopsies done. And if there's anything suspicious of a pre-cancer or a cancer situation, then they need breast surgery to correct that or take that out.
Wow. Well, you are a doctor of many trades there, so that is amazing. We're going to come right back with Dr. Vasudevan, talk a little bit about a new development, some new news about you on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back with Dr. Vanitha Vasudevan. Dr. Vasudevan, I'm just going to give out your info before I forget. I'll give it out one more time at the end. General surgery and oncological surgery. Number's 305-820-6657. But don't let that throw you off the 305 area code, because Dr. Vasudevan's actually in Fort Lauderdale. I know you started down in Hialeah and just kept the number with a really great group, the Center for Advanced Surgical Oncology. As you remember, we've had Dr. Legaspi on the show, Dr. Cohen, Dr. Abdullah, Dr. Vasudevan. Wow, we've had all the surgeons from the Center for Advanced Surgical Oncology. But you can find Dr. Vasudevan at 7150 West 20th Avenue. Oh, I'm reading your Hialeah one. I'm going to read your Fort Lauderdale one. That'd be better. That's closer to us. We do broadcast from Miami to Fort Pierce. But Fort Lauderdale office for Dr. Vasudevan, 3001 Northwest 49th Avenue, Suite 301 in Fort Lauderdale. That's right on the campus of Florida Medical Center. Right there, you can't miss it. Oakland Park Boulevard, right before the turnpike as you're heading west. A great hospital as well. Her number again is 305-820-6657. You can look at all of her credentials, physician info on tfpsdocs.com, and just type in Dr. Vasudevan's name or click on general surgery, and you'll see the great doctor there. Now, before the break, we were talking a little bit about breast cancer. Breast surgery is another treatment option you offer, but we're in South Florida, and another cancer that we have that's prevalent is skin and soft tissue tumor cancer. When does that become a problem, and when is a person need general surgery attention? Is it something that they're referred to by their primary care, or do we just call you up and say, I got this weird thing on my...
Well, most of the referrals come through dermatology. As you know, we're in South Florida.
Oh,
There's
dermatology.
so much cumulative exposure to sun. So especially in the sun-exposed areas with your head, neck, upper arms, and chest, there's areas... everybody in South Florida needs to be under surveillance with the dermatologist, especially white-skinned people where there's a higher chance of developing skin cancer. So most of the time we get referrals from dermatology that they would biopsy some suspicious-looking lesion, a mole that's, not looking right. And by not right, the characteristics are it becomes asymmetric, or it's becoming darker or bigger, or starts bleeding and things like that. Any new change in the moles that you have, especially in the sun-exposed areas, need to be biopsied. And those biopsies is a simple office procedure that is mostly done in dermatology offices, but we do it in our office too. And that'll give us an idea of whether we're dealing with a cancer or not. So the more dreaded one is a melanoma, and then squamous cell cancers, which are the other very common cancers in sun-exposed areas. So then they get a surgical referral from that.
And it's ringing a bell in my head now. I actually had a dermatologist on here early this year, and he did talk about those. Mm-hmm. But I didn't put two and two together that the dermatologist works with a general surgeon. Right. I was thinking primary care, which would happen as well, but mostly dermatology. Wow, that's good to know, and that's great that we have that type of care here in South Florida, because I've told the story a few times, and I'll be really brief, but I have a colleague in media who got driver's side melanoma from driving the same path to work every day, not having tint on his window and just taking that east sun in the morning. Right. He actually got driver's side melanoma on his face. Luckily they got it, but he's got a little bit of a scar, something you can grow a beard over, but scary situation. Yeah. Never thought of that.
So there is treatment of the primary skin lesion. Plus, especially if it's a melanoma, there are some indications where you have to check whether it's already spread to the lymph nodes or not, and all those require like an extra surgical step. And so you can't just take that particular mole out; you have to take it out with a margin, and then comes the question of how to reconstruct that part of the skin, that the amount of skin loss. So we have various techniques, like we use grafting and flaps from other areas in the body. And so a lot of work goes into that. So the best thing to do is regular surveillance and preventing it or catching it when it's earliest change.
Wow. That definitely, you said it there. Now, you also treat colorectal cancer as well. I mean, you're a general surgeon that does everything.
Well, general surgery, that is the beauty about general surgery, is that you're trained to do everything. And it's basically like a head-to-toe thing. So colorectal surgery is especially useful because, again, like we said, like any other cancer, colon cancers also need to be it's a mandatory colonoscopy that you get at like age 50 years. And everybody that is in a general, as part of your annual workup needs to get that done at least once after the age of 50, because they are able to pick up polyps and, anything that just before it turns cancer or in the earliest stages. so that we're able to get and tackle with it and treat it surgically.
And you said it best there, early stages preventative medicine.
Correct.
The quicker someone can get to you with
It's
anything they
always the
have
best. Yes,
is
it's
always the best.
results.
Like anything else, the longer you wait, that's when the problem. Dr. Vasudevan, we got about 2 minutes left, and we've got so much info out already, but I just want to get to this news. Congratulations, you are a new fellow of the American College of Surgeons.
Yes, thank you.
How'd that come about?
So American College of Surgeons are very prestigious, very, very old institution in the country. Basically cares about the quality that we deliver as surgeons. And so once we are in practice, we apply for a fellowship to the college, and I got I was fortunate to be inducted into the college this past month.
Nice.
So, yeah,
that's great news. I know last year you were featured in I want to say a journal we have on the
right. It was
as
a
well.
publication,
Publication.
research publication.
This year you're coming with us, new fellow of the American College of Surgeons.
Thank you.
What's next?
Well, long way to go.
Yeah, I know you put in a lot of hours, and you do surgery at Florida Medical Center.
Correct.
Okay, that's in Fort Lauderdale. Well, thank you so much for joining me on the program. I know you're a very devoted mom, a very busy woman, and to take the time to drive over to here to Boca. I mean, I know we're not that far away. We do broadcast in your area, but
Right.
I really appreciate on such short notice.
No
I
problem.
wanted to
Thank
get
you
you
for having me here.
on the show. And anytime you have any new news, don't hesitate
Definitely.
to let us know on the You and Your Doctor show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.